In gastroesophageal adenocarcinoma, there is many new exciting treatments coming through the pipeline, many of which are targeted non-chemotherapeutic options, which really means that tissue next-generation sequencing is exceedingly important in the management of this disease. One of the downsides, one of the drawbacks of tissue-based sequencing is that the heterogeneity of this disease suggests that a biopsy limits the utility of a single-site biopsy because there's heterogeneity within a single patient across different lesions, not to mention that biopsies can at times be invasive, if not even unfeasible. So MSK-ACCESS is a blood-based liquid biopsy tumor-informed platform that allows for comprehensive, less invasive sequencing. And so this is a retrospective series looking at our experience in almost 100 patients who had MSK-ACCESS collected prior to receiving any treatment. There are really two takeaways that we saw. First, from a molecular profiling perspective, that blood-based sequencing using MSK-ACCESS was concordant with the molecular profile that we found on tissue-based sequencing using MSK-IMPACT, of which we had paired samples of tissue and blood. There was one area in which the MSK-ACCESS appeared to be slightly less sensitive, and that was detecting copy number alterations, where it's particularly pertinent to this disease as ERBB2 amplifications have implications regarding treatment and HER2-directed therapy. So that was one area where we saw that it was less sensitive than tissue-based sequencing, otherwise significantly concordant. The second real important takeaway with blood-based sequencing is the idea of using it as a prognostic indicator, the idea being patients with detectable versus undetectable, specifically at each stage of disease. So we looked separately at patients within each stage, locally advanced, potentially curable disease, untreated metastatic disease, and then those with later line, more advanced disease who had progressed on first line and were getting second line treatments. And what we saw, of course, it's, the caveats being this is a retrospective series and relatively small sample size, but there was a signal that patients who had undetectable circulating tumor DNA had better outcomes, longer overall survival compared to those who had detectable circulating tumor DNA prior to any treatment. And then we also looked at patients who at the 10-week mark had a second collection, and those who had persistently positive compared to those who were initially positive but had converted to negative at that 10-week time point. And those patients appeared to be a little bit more similar in terms of their outcomes to those who were undetectable at baseline. But of course, prospective and larger cohort studies are needed to really validate these findings.